1. The Wide Range Achievement Test, WRAT, is primarily designed to measure which of the following: A. General intelligence and problem-solving ability. B. Academic skills such as reading, spelling, and math. C. Emotional intelligence and social skills. D. Memory capacity and processing speed. 2. The WRAT is commonly used for which professional purpose? A. Diagnosing mood disorders. E. Assessing academic achievement levels. C. Measuring motor coordination. D. Evaluating personality traits. 3. Which of the following is not a core area assessed by the WRAT? A. Word reading. B. Spelling. C. Arithmetic. D. Vocabulary, reasoning. 4. The word reading subtest of the WRAT primarily assesses: A. The ability to read words aloud accurately. B. The ability to comprehend complex passages. C. The ability to recognize letter patterns in memory. D. The ability to analyze phonetic structures silently. 5. The spelling subtest in the WRAT requires test takers to: A. Spell orally presented words in writing. B. Rearrange scrambled letters into meaningful words. C. Identify correctly spelled words in a list. D. Correct errors in written sentences. 6. The math computation section of the WRAT involves: A. Solving applied word problems. B. Performing oral calculations only. C. Working through written numerical problems. D. Memorizing formulas. 7. The WRAT is most appropriate for assessing individuals in which age range? A. 5 to 94 years. B. 2 to 12 years. C. 18 to 65 years. D. 10 to 80 years. 8. A key use of the WRAT is in evaluating: A. Reading and math skills for educational placement. B. Nonverbal reasoning ability. C. Attention span and executive functioning. D. Emotional maturity. 9. Which version of the test is most widely used today? A. WRAT 1. B. WRAT 2. C. WRAT 3. D. WRAT 5. 10. When administering the word test, instructions should be: A. Modified freely to suit each student's comfort. B. Read exactly as standardized in the manual. C. Ignored if the examiner is experienced. D. Simplified into fewer words for faster administration. 11. The WRAT is considered what type of test? A. Criterion referenced. B. Norm referenced. C. Ipsative. D. Dynamic assessment. 12. The WRAT provides which type of scores for interpretation? A. Percentile ranks and standard scores. B. Only raw scores. C. Performance bands only. D. Quotient scores. 13. Which population would benefit most from WRAT testing? A. Adults needing literacy assessment. B. Children with fine motor delays. C. Patients with neurological motor disorders. D. Individuals with auditory processing issues. 14. In the WRAT, the reading comprehension component focuses on: A. Identifying synonyms in context. B. Understanding sentences by filling in missing words. C. Summarizing lengthy passages. D. Answering inferential questions from stories. 15. Which of the following is a major advantage of the WRAT? It requires no reading ability at all. B. It can be administered quickly and efficiently. C. It measures advanced calculus skills. D. It diagnoses psychiatric disorders directly. 16. The WRAT is especially useful for A. Screening for academic strengths and weaknesses. B. Diagnosing specific mental health conditions. C. Predicting physical performance in athletics. D. Assessing long-term memory capacity. 17. The WRAT is standardized on a sample designed to represent A. Only children in private schools. B. The general U.S. population. C. Adults in occupational training programs. D. Individuals with known disabilities only. 18. Which subtest is most predictive of basic literacy levels? A. Math computation. E. Word reading. C. Spelling. D. Sentence completion. 19. Which administration format is available for WRAT 5? A. Only paper and pencil. Both paper and pencil and digital formats. C. Only group-based administration. D. Only oral delivery. 20. The WRAT is commonly administered by A. Licensed psychologists and educators. B. Parents without professional training. C. Peer tutors in classrooms. D. Physicians in general practice. 21. Which of the following best describes the test's reliability? A. Low reliability with large score variations. B. Moderate reliability limited to spelling. C. High reliability across all subtests. D. Unreliable across age groups. 22. The WRAT can help in diagnosing A. Reading disorders such as dyslexia. B. Motor coordination disorders. C. Hearing impairments. D. Social phobia. 23. Which subtest includes single-digit and multi-digit calculations? A. Spelling. B. Math computation. C. Word reading. D. Reading comprehension. 24. In the WRAT, the spelling subtest primarily emphasizes A. Letter formation speed. B. Correctness of written words. C. Synonym recognition. D. Sentence completion. 25. The WRAT provides results that can be compared to A. Nationally representative norms. B. Teacher-made classroom tests. C. International IQ databases. D. Self-reported academic skills. 26. Which of the following is an example of a reading comprehension task in WRAT 5? A. Identifying missing words in sentences. B. Defining vocabulary terms. C. Correcting spelling errors in a passage. D. Completing math word problems. 27. One limitation of the WRAT is that it A. Does not provide a measure of higher-order reasoning. E. Requires lengthy administration time. C. Cannot be used for adults. D. Lacks standardized scoring. 28. Which subtest is typically administered first? A. Word reading. B. Spelling. C. Math computation. D. Reading comprehension. 29. The WRAT can be used as part of an evaluation for A. Academic achievement in learning disability assessments. B. Motor skill development in physical therapy. C. Anxiety and depression severity. D. Speech articulation clarity. 30. Which is an advantage of WRAT 5 over earlier editions? A. Expanded age norms and updated standardization. B. Removal of spelling as a subtest. C. Exclusive focus on mathematics. D. Simplification into a single general score. 31. When interpreting WRAT results, an examiner should consider A. Test-taking behavior and effort. B. Only the raw scores. C. Personality traits of the examinee. D. Previous occupational experience. 32. The WRAT is best classified as a measure of A. Achievement. E. Aptitude. C. Intelligence. D. Personality. 33. What does the term achievement test in WRAT mean? A. It measures learned academic skills. E. It predicts future learning potential. C. It assesses innate intelligence. D. It evaluates social adjustment. 34. Which factor could negatively affect WRAT performance? A. Test anxiety or fatigue. B. High educational background. C. Familiarity with standardized testing. D. Having bilingual skills. 35. Which WRAT subtest would best identify weaknesses in basic written expression? A. Spelling. B. Math computation. C. Word reading. D. Reading comprehension. 36. Which of the following reflects appropriate WRAT use? A. Screening for literacy in correctional facilities. B. Measuring musical ability in performers. C. Testing reflex speed in athletes. D. Assessing fine motor skills in children. 37. What type of validity evidence supports the WRAT? A. Content and construct validity. B. Reflex and motor validity. C. Environmental validity. D. Projective validity.